So because cold plunge has become more and more popular in the last 10 years, I thought I would look into what newer medical studies there were since the last time I looked about the pros and cons of doing cold plunge. And basically, there are more studies showing, although there's not that many studies in general because it's still relatively newish in popularity, but there are studies showing that it can help improve with inflammation in the body. It can help with your immune system, improving your immune system. It can help improve your sleep. And it seemed that people who do cold plunge regularly felt like it overall improved their quality of life. Now, that's a time dependent improvement. So you would have to be doing cold plunge regularly. If you do it once, the benefits don't last for the rest of your life, unfortunately. But you would have to be doing it regularly and incorporate it into your self care or wellness routine. Now, the biggest con that I see is that, I didn't really see any studies looking at cardiac events in cold plunge. And the reason we would think about that is because there are a lot of studies looking at cardiac events and if people go out in the snow or freezing weather or just cold weather in general in winter, and there's an increased risk of cardiac events like heart attacks in colder weather. So if there's that risk, then you would think with cold plunge, the same risk would be there. That it's more of a risk if you have risk factors for heart disease like diabetes or high blood pressure, or even if you're in an older age, because that increases your risk of cardiac events as well, or if you have a history of heart disease. So definitely you should discuss it with your doctor before taking up cold plunge. And hopefully someone does that study in the future about cold plunge and cardiac events, because it does seem to be increasing in popularity a lot. So I would like to see that study too.